Bringing your business online is no small feat, but with Jane App by your side, they'll make the transition as effortless as possible. Let Jane lend you a hand with your mental health practice so that you can spend more time doing what you love, helping others. Learn more at jane.app/mental health. Welcome back. I have to say that the response to season 1 of WhateverWorks was really surprising and overwhelming, and so I'm absolutely thrilled to be bringing you season 2. This season is going to bring you new stories from people who've experienced different modalities and the story of how it worked for them. I wanted to start off with my own story of my experience with group art therapy, and so I invited my friend Zach Schrader to come and interview me about the experience. I'm Talia Singer, and this is WhateverWorks. In this season, we're sponsored by the Jane App. Here, you and I know a lot about each other.
Yes, we do.
No introductions needed. But I don't know if you know this story, my experience finding art therapy and the really transformative events that happened through art therapy.
Well, I know that you're very passionate about it, and I've heard you talk about it many times, but I don't think I've heard this story before.
It all actually began, I think, roughly around 2010. I was like in this really terrible professional and personal slump. And I experienced like this crisis when my daughter Noah was born. I just kind of like lost it. I couldn't even describe it at the time. And I reached a point where the slump was that I couldn't do it anymore. And so the thing that I tend to turn to when I'm feeling like I'm in a slump is I either change my hair, change my job, or change my career.
Which I have witnessed all three of.
Yeah. And I was like, well, I had already changed my hair and I couldn't change my job at the time because I had these 2 kids and the whole family was like, enjoying the benefits, healthcare benefits and whatever. And so I was like, well, I guess it's time I returned to school.
So at this time, you were a nurse, right?
This time I was like a community nurse.
Okay.
I visited people in their homes. I visited schools. I ran all kinds of programs. But I was really kind of in a bad place. I was feeling trapped.
So what did you do?
And so I enrolled myself in an art therapy program in Toronto in order to try and kind of change my outlook and see if I needed to try something new professionally. Once a week for 16 months, you attend a couple hours of group therapy.
Interesting.
And the group is run by this really lovely therapist, and she's like endlessly creative and inventive. Every week she comes up with a new activity for us to do. And so one week we're like doing puppets, creating puppets of our inner critic. And then another week we're sculpting figures from the past. Another week we're creating collages of our, unconscious selves. Another week we're creating a family portrait using only birds of prey. Like, she came up with the craziest, most delightful, most creative ideas.
So were you conscious during this time that you were undergoing art therapy?
I was treating it like a rainy day at camp. I was like, well, arts and crafts.
Okay, so it's like a innocent activity kind of.
I was treating it as art as therapy. So like the process of creating art is like therapeutic, just like taking a bubble bath.
I think a lot of people think of it that way, actually.
I don't think that there's anything wrong with using art as therapy. I think that the whole like popular culture around adult coloring books, there's nothing wrong with the kind of meditative, creative process. There's lots of benefits to art as therapy, but I really noticed that the other members of the group were not experiencing art as therapy. They were experiencing art therapy. They had very deep insights into their creations. And the therapist was so skillful at her really attentive listening, and she could pull things out of the artwork that simply blew my mind.
Mm.
And here I am watching the other members of my group. There was like maybe 10 of us, and they were having these like really deep personal epiphanies, and I was so jealous. I really felt like there's something wrong with me. I cannot connect with my creations the way other people can.
Yeah, I mean, you said you were already an uppity pessimist and resistant to it. So that's not surprising.
That's right. So sitting in my group as an uppity pessimist, completely resistant to any type of therapy, but like feeling like I had already come too far and I had to like continue with this. It wasn't that it was painful. It was like delightful. Like, use some clay. Lovely. Make a collage. Lovely.
Just a lot of lovely.
It was just a lot of like lovely, but like I think I was appreciating my artwork the way like, a parent like tacks up their kids' drawing on the fridge and be like, isn't that special?
Yeah.
So as the, 16 months slowly came to an end, I was like amassing a huge amount of artwork, like over 50 pieces.
Mm.
And part of the requirements of, finishing this group was creating a curated show of your art pieces throughout the time and group and theming them, finding a theme with all of the pieces of art that would describe kind of like your journey in the group.
Did you manage to pick out any themes?
We had picked like numbers out of the hat, who would go like first, who would go second, and I picked the last number. And I was panicking because I could not for the life of me find a theme, so much so that I created this whole presentation to the group about how my artwork had no theme because I couldn't figure out a theme.
Oh.
I was kind of disappointed in that fact.
Did you not find a theme because there literally wasn't one, or were you just afraid to really say what was going on?
Hi, I'm Sophia from the Jane team. We understand that it can seem overwhelming to transition to a new software. However, with Jane, you're not alone. Jane's support team offers multiple touchpoints along the way to ensure you're up and running as smoothly and as quickly as possible. We're in this together. Jane is a Canadian-based PIPEDA-compliant practice management software, offering a range of different features including customizable electronic therapy notes, secure telehealth sessions, simple online booking, family relationships, and more, all on our Canadian-based servers. If you have any questions whether Jane is the right fit for your practice, we'd love to chat with you. Watch a demo and connect with us by visiting jane.app/mental health.
Well, the funniest thing happened the night before my presentation. So it was the last group because I picked the last number and I was going to be the last one to go. And I was kind of like disappointed in the fact that I couldn't find a theme, but I went to bed and inexplicably at like 2:00 in the morning, I was like ripped from my sleep and I sat up in bed. And it's kind of like a scene from a movie. Like this never happens, where you like sit up in bed, fully awake, and it dawned on me, the realization, the theme, crashed on my consciousness like cold water.
Yes.
My artwork was screaming at me the experiences of the past few years. That all of that kind of like the slump was a result of the crisis, and the crisis that I would not acknowledge to myself, let alone anybody else, was postpartum depression. Like I said, it was like so cinematic because I'm opening up all these giant files with all these big paintings and all of these sketchbooks, and I go through every single piece, and every piece is my daughter Noah. Every piece is my depression, my shame, my absolute, what's the word? Torture of experiencing postpartum depression and never speaking of it to anyone.
That's interesting to me, but I bet that was interesting for you too, because as a nurse, you probably know about postpartum depression real well.
I knew it like very textbook wise.
Yeah.
And I also went to visit women in their home as a nurse who were struggling with postpartum depression. But it's really incredible the way you can kind of like resist turning that kind of very shameful, stigmatized lens on yourself.
Mm-hmm.
Because the way I experienced postpartum depression actually didn't involve any tears. I would not really allow myself to be sad. I was enraged.
Yeah.
I think I was like enraged and I was numb, completely numb.
Mm.
My daughter was born in 2005, and the minute they placed her on my chest, I felt like I was doused with cold water. And despite appreciating her, much like I was like appreciating my artwork from a very distant point of view, I really didn't feel connected to her.
Right. Do you think that art therapy maybe helped you, I don't know, express that or realize that at a deeper level?
Absolutely.
And I think of it too sometimes like, you have this, you may have a, problem or an issue, and it's like a set of keys and you have to keep trying the keys until one of them works.
Mm-hmm.
And then all of a sudden the key works and you're like, whoa, this worked for me.
Yeah.
And maybe that's what happened, at 2 a.m. when you felt. It's interesting. You described that when you had Noah, you felt like you were doused in cold water, and you used the same analogy when you had the realization at 2 a.m.
Yeah.
about all of your art. I think that's interesting.
Yeah, exactly. And I think that I would have not been ready to admit this to myself until the very last session when time was running out.
Mm-hmm.
I had to have the pressure of like losing this group, knowing that it was the last session, to fully admit to myself all of these thoughts and feelings.
Mm-hmm. And I mean, you were last to go too. So, and I think I know you pretty well, and I can just imagine, you, saying in your head like, "Great, I'm last," and you're putting all this pressure on yourself, to come up with this theme, and then it just kind of happened.
Mm-hmm. Mm. Well, I'm typically the person who likes to like get it right, like do it right.
Of course.
Like even as a therapy patient, and I couldn't help feeling like I'm doing it wrong.
I am the exact same way. I actually get really self-conscious. I've tried it before. I get really self-conscious because I don't. I think I have to be good at it in order for it to work.
Mm-hmm. Mm-hmm. Yeah, I think that's a really common misconception with art therapy. And what I usually tell people is that imagine like speaking through pictures, like imagine your own set of hieroglyphs. It doesn't have to make sense to everyone. Only specific people in the world can interpret hieroglyphs. You have to be able to understand it. And if you can explain it, interpret it for me, that would be a bonus.
Yeah, and sometimes it takes some, simmering while you sleep for it to happen, I think, too.
Yeah. I think what's funny is kind of like the length of time, and also the lengths that I went to have this realization, to finally admit it to myself. Like I didn't just get up and take myself to therapy. I think people don't give themselves enough credit for just being able to go to therapy in the first place. Like first I had to enroll myself in a $30,000 post-secondary program. And then therapy had to be like mandated by the program. And even then I was still resistant to the very last second. And that's how challenging it is to go to therapy.
Mm-hmm. And I think that's a valuable realization as a therapist too, right? As you understand your clients better when you have that type of experience. Mm-hmm. If you take yourself through the process of going through therapy and having to amass this collection of work that you did and finding themes, what do you think happened to you? What process do you think happened?
Well, what's funny is that I think that the unconscious, works in very mysterious ways, even to ourselves. There was something within me. I was like literally trying to tell myself something that I was really blind to, something that was a very deep truth. And if it wasn't such a deep truth, it wouldn't have resonated so much. I waking up at 2 a.m. with that understanding about myself, it could have only been that, I guess, impactful if it was true. And it felt like it was something that I had always known, but something that I had denied for just so long. There was actually kind of a feeling of relief along with it. I honestly didn't let myself even think of the word PPD or whatever. I literally remember having the thoughts of I was living in a condo at the time when my daughter was born, and my husband would get up and go to work. And then the thoughts would start. The minute he left for work, I would tell myself, don't jump out the window today. And I also remember thinking, should you tell anyone, Talia? They'll take your baby away.
Yes, of course. So a lot of fear and external fear of what might happen if you actually do, give voice to these feelings.
So much fear.
Yeah.
Fear of being unwell also. Like, when you're in the caregiver role, it's actually, I feel like it might be even more frightening to be unwell, almost because of like all of the knowns. I had worked in hospital, in psychiatric units, and I had worked in the community with mothers who had, Children's Aid Society involved in their lives. And all of these scenarios, I just kind of like, I just envisioned in like a possible future. And so I just blocked it all out. And I just kind of like said, nope, never happened.
Yeah. Yeah. And I can see, a type of dynamic. Arts and crafts are a thing that we often associate with, being a kid, feeling safe, expressing yourself in a certain way that maybe you're not used to as an adult. I certainly don't do arts and crafts as an adult. I mean, I know there are some who do, but I can see how that's a link that can be made.
Absolutely. And I think there was also, I was made ready, and I can't stress this enough, by the bravery of the people in my group expressing themselves and having their own realizations and deep connections. That witnessing people being so brave made me brave.
And that's a testament to, the power and the power of group therapy and seeing other people, work through their stuff. If you were to, talk to someone who, might be going through something similar to what you were going through, what would you tell them about art therapy?
That's a really good question. I would tell someone who had never tried art therapy, imagine there are so many ways to tell a story. You can do it through music, you can do it through paint, you can do it through clay, you can do it through words. There's actually a great subset of art therapy called bibliotherapy, where you only use quotes or lyrics or passages in poetry. Art therapy is actually really varied. There's so many different ways to speak.
I think that's really powerful.
One thing I always ask people on this show is whether they think it was the medium or the therapist in the situation that helped them.
And so what do you think? Do you think it's the medium or the therapist or both?
Yeah, I think that a lot of people on this podcast, it had to be both. So it had to be the kind of seemingly innocuous, really safe therapeutic intervention of creating artwork and not having the pressure of it meaning anything. Meaning I could just create art because art is so lovely to look at and it's therapeutic making it. And then the combination with this highly skilled therapist that never pushed me to see beyond the work and never really challenged me beyond where I could go. She really accepted me as I was, as a member of the group. I didn't know if this would be the thing that would help me like move forward in my life. But it actually launched me into a whole other chapter of my life I never expected.
I think that's the awesome thing about therapy in many ways is sometimes you don't get what you expect out of it. And it, like you said, opens new chapters.
This has been the first episode of the second season of WhateverWorks, sponsored by the Jane app. I'm Talia Singer. This podcast is written and produced by me and edited by David Conroy and Jason Ball. The theme song for this podcast is called Universal Donor, off the album Hopeful Monster, written and performed by Jason Ball. You can find it on Spotify and Apple Music.